So hello, everybody. We'll get started with today's presentation on coming from PATH. We're titling this Data for Action, Fighting Disease with Visualized No Malaria. And my name is Jonathan Drummy, and I'm a data visualization specialist here at PATH. Just a little housekeeping to start. We'll be monitoring the chat and the Q&A. We'd prefer if you have questions during the session, ask them in the Q&A. If I've got them open on another screen, if I can, I will answer them during the session. And if not, we will follow up and answer them later. So with that, let's get started. So there's a variety of people who we know in advance signed up for this webinar. And in thinking about who the different audiences are, I just wanted to call out to the different people who are here. So you might be familiar with PATH, but not the Visualize No Malaria tool set of the project. Or maybe you're familiar that the tools we've been using in Visualize No Malaria, but not necessarily the project or PATH. Maybe you're curious about why we've chosen to use the different tools and methodologies that we have versus others, or maybe curious about all of the above. So hopefully we'll be able to address these different audiences. If you are not in one of those audiences and have other questions, please ask, and we're happy to answer and share what we know and also tell you what we don't know. So just a quick agenda here. So I'm going to do a little bit of introductions to satisfy those audiences, talk about our approach in the Data for Action group at PATH, the systems landscape that we generally work in the arena of public health, the Visualize No Malaria architecture, so VNM is short for Visualize No Malaria here, and then talk a little bit about each of the tools and wrap things up with some Q&A. So again, if you have questions, please ask them in the Q&A, and I'll try to get to them if I can. If not, we will follow up. So introductions, I'll start out with me. We're leaving video off for this just to save bandwidth for our friends in faraway places, wherever those may be. So I'm a data visualization specialist here at PATH. I started out several years ago as a volunteer on the Visualize No Malaria project and then was recruited to join PATH. So my prior work, I worked primarily in healthcare and telecommunications, interacting with data in different ways in those. I started using Tableau several years ago and was selected as one of the first Tableau super users. Tableau calls them Tableau Zen Masters. And I'm a big fan of Tableau. I can talk a lot about what it's good for and what it's not good for. And I've also gotten really involved in the online Tableau community. So I've been a forum ambassador there as well. And for a while, I led the Tableau healthcare user group, which was primarily focused in the United States, though we also covered other parts of the world. And in my role at PATH, I support projects to improve their data visualizations, whether that's using Tableau or other tools. So that's training, office hours, ongoing support. I do work in a consultative role in building up helping to build views and dashboards for projects. And then I also help administer our data visualization infrastructure as well. So just a few disclaimers on this. So the views and opinions here are mine and not necessarily PATH's. PATH is a grantee of Tableau Foundation, Alteryx for Good, Mapbox, Exasol, and Twilio, which I'll all be talking about today. Personally, I don't receive any compensation from those firms, though I have spoken at their conferences and gotten free t-shirts and other swag. And also with Tableau in particular, as a Tableau Zen Master, I have an NDA with them. So any information I'll be sharing about Tableau is information that is already available in some public way. So I'll talk about PATH a little bit. So we are a global team primarily working in maternal and child health around the world. So there's 1,500 of us or more in 70 different countries. I'm based here in the United States. Most of my work is with partners in sub-Saharan Africa and elsewhere in the world as needed. And PATH works in 5 key areas. So vaccines, so we were part of the project making the first malaria vaccine that was just going into trials in Malawi last week. Diagnostics, drugs, devices, or other areas, and then health systems. And that health systems is primarily the area that I work in digital health projects. That's an overview of PATH and me. Let's talk about Visualize No Malaria and more generally malaria as an issue in the world. So in 2017, malaria killed about 435,000 people worldwide. And it's a huge, beyond just the sheer emotional cost of the deaths and the need to care for families and the grieving, there's also the entire socioeconomic cost as well of malaria. So it's the largest killer in the world. And right now on a global level, progress is kind of stagnating. So the latest World Malaria Report was for 2018. Next one will be coming out soon. So there was a reduction in malaria cases between 2017 and 2010, but overall things have kind of, progress in eliminating malaria has kind of leveled out. And in Zambia, where Visualize No Malaria started, and what I'll be mostly talking about today, the population is between 16 and 17 million people there, and over 14 million are at risk of malaria. And Zambia's goal is to eliminate malaria by 2021. And so we've been part of that. And we use a variety of different interventions for that. 3 major interventions, so bed nets, indoor residual spraying, and optimizing care. So we've worked with the Ministry of Health in Zambia to distribute bed nets and improve usage of them and monitor usage of them. With indoor residual spraying, we've supported Zambia to double IRS coverage between 2008 and 2015, and particularly in rural areas, increase that coverage by over a factor of 7. So huge improvements there, and we're seeing results on that. And then one of the biggest things that we do is rolling out community health workers. So adding that as an intervention, reducing the distance that people have to travel to care, to get malaria care, so they get the care they need, they get the treatment they need, and there's less parasite in the local population to be transferred to other people. And then we've been innovating along the way as well. So, so we've been doing mass drug administration in Southern Province and research on that, the RTSS malaria vaccine that I mentioned, and the Data for Action and Visualize No Malaria project as part of that I will talk about more. So it started as Visualize No Malaria started as a partnership between the Ministry of Health and PATH and the Tableau Foundation. So PATH and the ministry were already working together with the MASEPA project, Malaria Control and Elimination Program in Africa. And we saw a need for improving data use. And so partnered with the Tableau Foundation on that to launch the project. And then over time, a variety of volunteers got involved. As part of that, Tableau reached out to their user community, and there's me, I was part of that. And then the data visualization component wasn't the only component that we needed to bring in other components as well, and that brought in a variety of other partners. So Datablick and Slalom were both consulting partners, and then various technology companies as well being involved with that. And I'll be talking, so in this place, what we were taking advantage of an underutilized resource, which is these companies that were offering great software and great tools for doing tasks that we wanted to do, but weren't ones that had been used necessarily in this kind of public health space before. So we were able to connect with them and open things up. So we were one of the first grantees of the Tableau Foundation, one of the first grantees for Alteryx for Good and Exasol and so on, and helping in this tradition of Path being an innovator, helping these companies to open up to other partnerships with other organizations. So some of the Tableau Foundation supports a number of different organizations at this point. They've been at this longest of these, and then the others as well. So it's been a really fantastic partnership, some milestones along the way with that. So Path and Tableau signed the agreement in late 2014. And then we started getting involved in the initial set of use cases in 2015 and started rolling out dashboards pretty soon after in 2015. So this was primarily volunteer work, so it did go slower than if people were full-time on this. And then we started bringing other partners in and did our first visual analytics training in Zambia in 2017. And then also in 2017, we replicated the code to Senegal and built views there. And then we did that last year in Ethiopia in under 2 days, which was a success in doing that. And then Bill Gates, as part of the Bill and Melinda Gates Foundation, presented the Commonwealth Heads of Government meeting in April last year using a number of visualizations that we and our partners had built. And then just last week, as part of World Malaria Day this year, Tableau, Alteryx, Exasol, and Mapbox announced a $4.3 million grant of software and services, which we're already taking advantage of. And so this is a slide that I wanted to go to talking about success in Zambia. So one of the things that we're seeing is primarily in Southern Province where the project has been active, we've seen an 80% drop in malaria cases per 1,000 population. Going into 2017, we sustained that into 2018. While in the rest of Zambia, there's been a decline, but not as much. So at this point, the set of interventions that we've been using for the data visualization components, as well as the community health workers, the indoor residual spraying, and so on, and the use of data around that are being rolled out to the rest of the country. So my Path colleagues in Zambia are doing a tremendous amount of training and train the trainer training and so on to scale up to the whole country. So we can reach that goal of eliminating malaria in Zambia by 2021. And along the way, the Visualize No Malaria piece being this novel use of commercial software in the public health space, we've gotten a lot of great press and various awards along the way. So there's a nice little list there. And tomorrow we're picking one up from the Drexel Labo Analytics group. So it's kind of exciting to have, for me as a data worker, to have the recognition of my peers in this work and not just seeing the incredible work that's happening on the ground. So it all goes together really well. So what does this look like? So we've built various dashboards for users to use to dive in and work with and explore their data in new ways. And integrating different data sources. We've been leveraging a variety of different mapping technology and data sources. So this is looking at water flow over time near Victoria Falls and Livingston in Zambia. So we're using this to identify areas where water would be pooling over time to build out predictive models. we're also working, instead of working with thousands to hundreds of thousands of records of malaria cases and so on, we're getting into tens of millions and hundreds of millions of data points. So for example, this one, we've got, again, you're looking at water flow, but loading it in for all of Southern Province, Zambia, into Exasol to work with that, and then being able to visualize that. And then as part of this, because we have these new tools and we're going into areas and they're trying to figure out like what's going to work here, we're identifying new metrics as we go and being able to build those out on the fly and work with them. And then another piece that we've been using, this is where I got involved in the project early on, is doing messaging. And so we're doing reminder messaging as well as delivering views and visualizations to people, whether that's through email or in this case through cell phones, and helping people to get timely, accurate data so we can monitor progress during the season, but also fix problems as soon as they're notified, and create a feedback loop. And then there's the capacity building, where we're not just providing a suite of dashboards and so on and teaching people to use them. We're actually teaching people how to use the tools so they can do things for themselves. So this picture's from a couple of weeks ago in Zambia. It's a provincial health information officer who was not a data person, but was really curious about malaria incidence rates for health facility catchments along Lake Kariba and further out. And then through this process, there's these, I'm going off on a little tangent in this because I like the story so much. But in this process, finding catchments that were right next to one another with very low and very high incidence rates, leading him to go deeper and deeper into exploring the data. Being able to do that on his own without having to get a ton of help from other people was just fantastic for him to be able to do that. So it's an overview of Visualize No Malaria. I'll go deeper into bits of it as I go. I want to talk a little bit about our approach within Data for Action and how we're working with data in some different ways. And I'm going to start out with a little video here talking about the kinds of data that we work with and where it comes from. And I lost my video. Okay, so I'm going to for time, I'm going to let that go. And I'm just going to go back to this and just narrate it for a second. So, so a lot of our data, we have community health workers who are out there in the field collecting data. We had a picture of some earlier over in this slide. And so as they are capturing data, I'll just play this video. So they're out walking to places and everything, and they're entering data into logbooks and then doing data. So there's a logbook, for example, and putting data on an aggregated basis through cell phones, or in the case that they have web access, into DHIS2. And then from there, we are taking DHIS2 and putting that on a variety of dashboards that people use. So that's one set of data pathways that we use. On other projects, for example, in Tanzania, we're working on childhood immunization work there. There's data captured on internet-connected tablets, so it's into the destination systems right away in that case, and there we're pulling that data out. So stock information, so basically supply chain information, and as well as the actual immunization records themselves. And then we're able to visualize that in Tableau. And then we have the larger data sets, whether it's looking at 20 years worth of precipitation data for Zambia and starting to look at how climate change is affecting rainfall in Zambia. So right now the rains are tending to come later, and the amount of rain that they're getting is varying over time. So trying to get an understanding of that. So ranging from these very fine-grained data sets of community health workers collecting data to very, very large data sets is our environment. And our ideal state when we're working with data would be that we have some set of questions that we're asking of the data, and they all kind of line up and get organized in a good way. And then the data that we're actually working with all connects together, all the different sources that we're working with, and we're able to go through and turn our questions into answers and be successful in that. And so I've used this set of slides a few times before, and I've asked this, and nobody has ever said, this is always the way things are for me. Very often, we're more like, we have a set of questions, but then those questions connect to other questions, and they're not necessarily well organized, and our data is not necessarily well connected and interlinked, and then we have other issues, whether that's connectivity or data quality or timeliness and availability of the data and then there's our issues, do we have all the skills that we need to munge the data, have tools that can visualize and express that data, and then our work starts piling up, and we are not very happy. So how do we get there into that current state? And a very common process for thinking about working with data is there's a set of people who have some questions of that data, and then there's the people who are going to provide answers to those questions. And then we'll go through a linear process of defining the questions, collecting the data, cleaning the data. Time is passing, people are waiting, we're preparing the data, we're doing the analysis and reports, and then finally, in that place of being able to share and start archiving the data, and a lot of time goes by, and people are getting unhappy because they're waiting on that. Plus, this assumes that we have a full plan at the beginning of the process. It's assuming that the staff that we have all the skills that we need, that the data isn't missing anything that we need for that plan, and that overall this time there aren't any changes to requirements. So this is part of why we end up with systems that don't meet user needs. And that poor analyst is not so happy. So this work really isn't happening. We try to make it into a linear process, but it's not a linear process. And so what if, acknowledging it's not a linear process, what if we put humans right at the center of that process and thinking about what it is that they need to do that? And so we came up with this model for doing this, and there are 4 parts to the model. So the first part is expose, where we want to get the data in front of people as soon as possible. And as much as possible. So having those exploratory dashboards, having data that has warts and errors and invalids and so on in it. So that way, instead of trying to improve data quality so we get better data use, we're improving data use, and that way we get better data quality. So when we show people, we show a district health information officer, here's your facilities, and oh, by the way, 5 of them are not plotted on the map, that motivates those district health information officers to go out and get those coordinates for those facilities and validate them. So let's expose. Then there's explore. So in explore, we're in that going through the data, trying to get a sense of the data, of what it has to tell us. And a lot of dashboards and things like that kind of stop there. They're exploratory dashboards. And then the next piece is explain. And in explain, here's where really understanding what are those sources of variation in our data? Why did this number end up this way or not? And this also gets us into the predictive modeling of the data, so we can identify what do we think malaria prevalence is going to be in an area in a certain place, or we've identified the causes for stockouts of our vaccines, and from that we can start generating alerts to people to restock and make that happen. So that's explain. And then ultimately, this is all about empowering users to be able to do their jobs better, faster, easier, and so on. So in this model, when we have this kind of model, we're looking at tool sets that will let us rapidly integrate and work with data, be able to explore that data and have the power to start explaining the data. And in this, because this cycle is not a linear cycle, it's things happen in different ways. To move to that explanation, we may need to be integrating other data sets that we will have to go through an expose phase as we're working with them to understand their content and so on. So I could talk about this a lot more and have a lot of examples, but I just want to use this as a framing exercise for our underlying philosophy of why we do what we do and how we chose to use these particular products that we're using. And with that, I'm going to talk a little bit more about the systems landscape. So in this, so this is an example, actually just to talk about this dashboard on the right here, a view. This is a little window on a dashboard that we just finished, where the background little blobs are, the gray blobs are places that were done by indoor residual spraying by our partner Reveal, formerly Acros, and sorry, the M-Spray project with Acros and ONA and other partners. And here we've taken that data and overlaid it with where community health workers are located. So each of those circles is a 2-kilometer circle around a community health worker, and we looked at how many cases they've had recently. And we're using this to target a second round of indoor residual spraying. So this is an example of taking a data set that, and then using it to identify exactly where we're going to target indoor residual spraying. So for example, up here, this is pretty clearly, there's a little bubble of incidents going on, and we're going to target spraying there and so on. So on the systems landscape, do an overview, integrated versus modular decisions, talk about free and open source software and commercial off-the-shelf software and governance. And so, so when we started with Visualize No Malaria in 2014, there were some core issues that were leading to the projects happening. So one of them was users couldn't pull as much data as they wanted from the source systems, which is primarily DHIS2 in this case. So they'd go to DHIS2 pivot tables, for example, and try to pull down the data, and it wasn't, they couldn't pull down as much as they wanted as fast as they needed it. And then they also challenges integrating data from other sources. So for example, the population data comes from the Central Statistics Office and has a different structure and format. So yes, they could manually do that in Excel. How could they do that more easily? And then in terms of getting views that they needed to answer their particular analytical questions and move their way through the data in the ways that they needed to, that wasn't available at the time. And DHIS2 is an example of what I think of as an integrated system where it's doing a lot of different things as an operational system. It's doing data capture, it's doing data validation, it's storing data, it's got a set of reporting built in, there's dashboards built into DHIS2 and so on. And there's other tools as well out there in the public health space like ComCare and DDMS and so on. And one of the things that we find with integrated solutions is that they often have scaling issues. So for example, handling new conditions. So if a system is designed to handle one disease, what happens when there's another one? Or you want to perform new analyses. So that's a key example here within Visualize No Malaria. Higher volumes of data or reporting that you want to do out of the system. Can they integrate other data sets that aren't part of what they were built for easily? How well do they handle new user requirements over time? And modular solutions can also have integration issues. That's part of the challenge of being modular. So there's not necessarily that out of the box piece. So if you're using DHIS2 and you build it for your malaria work, DHIS2 is going to be the fastest thing to visualization you can have because it's got the visualizations built right in there. And also modular solutions can require a larger investment at the beginning in terms of skills or time or so on than integrated approaches because they don't have all of that advantage of that integration work that's been done in advance. So they're different approaches and I can't say which one's gonna work for you. I'll just give you our take on kind of how we ended up where we're at. So there's two core issues that happen. So we can look at these integrated systems as they're being used as operational systems. So they're doing data collection, regular data use and reporting and so on. And then we have this universe of analytical questions that's out there. And that set of analytical questions is always, always, always going to be larger than what those operational systems are designed to answer. So whether that's, we've got a system and we've got 10 years of data in that system and I want to do an analytical question that's going to go across 7 years worth of that data and the system won't let me pull it out, all out at once, for example, because that would, and there's very good reasons for that sometimes, like it would impose too much load on that operational system and impact other users' ability to do their jobs. So in that, there's the separation here, and then there's always additional systems with other data sources that users want to work with. So in that environment, an integrated system is never going to be able to always answer every question people have with their data. So this is a key piece of just recognizing and owning that there's got to be something else. And for most all of us, we do have something else on our desktop or our laptop, and that tool is Microsoft Excel. It's the most commonly used business intelligence tool in the world for that reason. And another thing, just as far as FOSS philosophy around data systems, is that we're not trying to build systems on our own. So we're not trying to build yet another integrated system. We're trying to help our partners build and own their own systems, knowing that they're in this heterogeneous environment where there's multiple systems doing different things that will evolve over time. So when we're thinking about a modular approach, we're being willing to say, okay, what's the best tool for different things that we're doing? So there's data capture, data preparation, maybe a separate data storage system, maybe not, depending on the use case. There's reporting, data visualization and dashboards, geospatial, predictive. So being open to integrating best tools for the job. And in our case, in thinking about the tools that we use, like Tableau, for example, Tableau natively connects to 70 different data sources. So it was a tool that was designed from the ground up to not be in a homogeneous environment, but to be in a heterogeneous environment where it could connect to any number of different things, and then also having tools to enable users to build more connectors on their own, like the web data connector technology in Tableau. And the other tools that we use, like Alteryx, are very similar for that. All right, so just checking in on time here. I'm going to move pretty fast through this. So free and open source software and commercial off-the-shelf software. So this is often an issue for people in the public health space. And just to own where I come from, I started using Linux in 1992, the year after it came out. And throughout the 1990s, this was when Microsoft was the kind of titanic monopolist in the operating system space. I worked for software companies that were literally put out of business by Microsoft changing their plans of what they were doing. So I thought a lot about, like, why can't tools like Linux take over the world and be what more, or maybe not take over the world, but take over enough and be a competitor to Microsoft. And one of the pieces I think about is who's your customer? So you're a developer, you're building something, who's your customer? And very often with open source projects, your customer is people like you, or you're doing something for yourself. And so statistical languages like R or Python, which is stats and general purpose language, Linux and so on, are built that way, and they tend to assume that the users are going to also be fairly highly skilled, like developers are. Then there's maybe your customers, large organizations who are purchasing the tool. And in that, so for example, all of our PCs that come with Windows and Office installed, the customer there is the manufacturer. Or maybe it's an enterprise in some cases. And in that case, there's this incentive that we need the price to be low enough to get somebody to purchase it, because the managers who are signing off on the purchasing are very price focused, and the features have to be good enough. They don't have to be great, they have to be good enough. And that's different. Then in the newer age, we have organizations that are purchasing the data that you're collecting. So Google, Facebook, Twitter, other social media companies, their customers are the advertisers and so on that are buying that data that's collected from us, the users. And then in the public health space, we have donors funding development, which creates a different set of incentives. And then there's having your customer be the actual end users who are using the data. So in these middle three, the user is not the customer. And for a lot of open source tools, low skilled users aren't the target. So what's the impact of this? Well, here's some R code for copied it off the internet, and this is for drawing a map. So we've got several lines of code. There's lots of typing and everything in here to do this. Now I'm going to do a little demo of Tableau. So 3 clicks, select province, select malaria cases, click on the filled map. We've got a filled map of provinces in Zambia. And we're really interested in that because everybody is working with data. Pretty much every health facility in Zambia has charts on the wall. They have maps, hand-drawn maps on the wall. They are working with their data, regardless of whatever tools they have available. So in this case, we want to give people tools that are appropriate to the skills that they have. And having to write code to draw a map is not something a lot of people have the skills to do, nor do they necessarily want to have to learn to do those skills. So ease of use is a really big deal in there, and the tools like Tableau and Alteryx and so on are focused on that. I want to talk about cost for a second. So here's a set of different things that are all costs to implement a new solution. And the ones in blue here are the only ones that are specific to commercial software. So all of the rest of them are all there regardless or not. And when we start doing the math, that cost of licenses is not necessarily the largest factor. And I also want to talk about this piece around quality of outcome sum. In that this can be really hard to measure, but how much are these tools helping people, and how useful are they? And here's an example of it from my own work. So being more of an open source person, I was working for the local hospital system at the time. So low resource environment, had to use open source because we couldn't necessarily afford other things or thought we couldn't. So I had this monthly data load that I was using SQL, Python, Visual Basic for it. It took 16 pages of written instructions in 3 to 5 days every month to do this data load. So there's a little bit of the SQL code from that. And I was happy doing what I was doing. I thought it was great. And then I got turned on to this tool called Alteryx. And I realized it had a possibility. And so I took that 16 pages of instructions, turned it into a series of Alteryx workflows that, instead of taking 3 to 5 days per month, took 1.5 hours per month. And oh, by the way, that was running in the background, so I could actually do other work in that time. And I got tremendously improved data quality out of it. So I wasn't sold on the possibilities of these tools to impact my work until I'd used them. And that quality of output let us do better patient care. So it had some real world effects. So there's other piece with open source about creating and contributing to global goods. And this is something that different people value that, or different projects and so on will value that in different ways. So it may be really important to some projects, and that's great. And in other cases, it might not be so much of the focus of that project to be creating global goods in the sense of full-on open source tools. That said, I want to be careful of creating a false dichotomy that commercial software could never create a global good. And there's a couple of ways this shows up. So one of them is that the commercial companies, at least some of them, like Tableau and Alteryx and Mapbox and so on, know that there's a ton of smart people among their users out there, and by engaging with them and supporting with them, they will do amazing things. So on this, so where's my Safari here? So here's Tableau Public. So these are visualizations. Anybody in the world can put them up online. There's 1.5 million visualizations of Tableau Public, and you can literally search for just about anything and find visualizations on it. And then coming out of this in the community, there's something called Makeover Monday, which is for making over visualizations. And last year for World Malaria Day, we put up a data set of simulated data from Zambia. And what we're scrolling through here are a number of the over 80 visualizations that were created that week by people working in their spare time who did not know malaria, as working with public health and malaria, and making all of these different visualizations, which the vast majority of them, we can download the visualization, see how it was built, and use it ourselves. So, so within the Visualize No Malaria project, we worked with this explicitly so we could get visualizations that we could use as training resources and teach people the art of the possible. As far as building interactive dashboards, doing more infographic views like this one, and so on. A number of these companies also have GitHubs with a lot of free code and so on. And then there's the piece around these companies. They're made up of people. People want to do good, whatever they're doing, and that's some of where things like Tableau Foundation, Alteryx for Good came out of. They have volunteer programs that you can use. And then there's also people in those organizations who can be ambassadors. So here's, so this is Joseph Mutale, who's from Zambia, and he's an employee at Tableau in their finance department. And here he is speaking in front of 17,000 people at the Tableau conference last year. So there's Joseph. And he was on vacation in Zambia and visiting, and used his vacation time to come by the class and talk with them. And the impact on the students in the class was just fantastic to have somebody coming there and sharing his insights and his hopes and dreams for the work that they were doing. And we wouldn't get to do this if we weren't connecting with these companies. And then I mentioned all the volunteers before. In this, of all these people and all this wisdom we're able to use in building things out. So for us, in thinking about what we were going to use to solve these problems of helping people analyze and work with their data, we were making connections with historically untapped resources. And we did receive grants for the software, which took that cost of software out of the equation. And then we also had the user community that we were leveraging. And we're using these tools that had lower required skill levels, faster time to implement with it, and having these tools with really high usability. So I'm going to go a few more minutes and then we'll do Q&A here. So with governance, oftentimes there's this issue when people are trying to get a handle on data, and they're in that space of being overwhelmed by all the questions and all the different data sources. There can be this wish to build some sort of data warehouse or data repository, put all the data in it, and then we'll be able to answer our questions. I'm going to strongly suggest you don't do that. For one thing, perfection is the enemy of good, of being good enough. There's also, in that time to implement, how many lives are you not touching or saving in that time by not having tools that can work with the data? And the underlying fact is, users have questions now. They have jobs that they're trying to do. That district health information officer who takes responsibility for eliminating malaria in her district is going to go out and find data and work with what she can to do that. And that might be the wrong data. They're going to use the tools they have, like Microsoft Excel. So when we're thinking about governance and implementing systems, we've got to level up, to use a gaming term. We've got to be in this space of both and, where yes, let's do the work to build out data pipelines that have governed data sources that are documented and everything, as well as provide users tools that let them work with the data more easily, faster, better than Microsoft Excel, and the training to go with them. So that's how we ended up with the tools that we have. The last couple minutes, I'll talk about the architecture for a little bit. So we have community health workers and health facility staff who are reporting data that's going into DHIS2. Then we're using Alteryx and a little Power Query as well to process that data and prepare it. Some data is going into Exasol, some's going into Excel and text files out of that. As far as storage of the data, and then we're visualizing that inside of Tableau. And then out of Tableau, for doing feedback, we are sending messages through Twilio to that SMS reminders. We're also doing email reminders and so on out of that. And then maps are a whole component of this. So we have Mapbox and Digital Globe in that as well. So that's the fundamental pieces of the architecture. These tools are really complementary to each other and complementary to other data sources and other tools as well in terms of pulling in and visualizing data. So, for example, within Zambia, there are basically 3 different IRS project, indoor residual spray projects going on in different parts of the country. And we're able to integrate and handle all of that and provide a national level picture of indoor residual spray that never existed before in Zambia, because there was only these localized data sets. I'm going to skip this for time. This is a huge chunk of why we use Tableau is just that it's really fast to be able to build out views, connect to a variety of different data sources, and then have interesting and innovative visualizations. So I'll skip to this piece where we're putting this map in motion of malaria incidents over time. In the case of Alteryx, for us, being able to handle data in whatever structure it comes in, if you're a data person, you know this is really hard to work with as a data table and everything. And in the case of Alteryx, we're able to take that and create a workflow that can be run on a regular basis, adapt when new columns or rows are added. And then in this case, it takes 0.6 of a second to run. So being really fast to handle these data problems. Exasol I talked about earlier in terms of just being incredibly fast and flexible. We can run Python or R code and use that to push data into the database, read data from the database, or actually use it inside the database. For Twilio, we are doing messaging. And this is really closing the loop. So users are entering this data, and the data review meetings might be once a quarter or so. And we're able to give feedback within days on things like data quality and everything. And that's really changed how people perceive their data, and we're looking at innovating more in that area. And then Mapbox lets us do just amazing things in terms of integrating really large spatial data sets and then being able to browse and navigate them really quickly. So here's a view of cell tower view sheds in Zambia built by one of our volunteers. So the yellow is where there's a lot of cell towers, and then fading out as there are fewer cell towers. So last couple of slides here. So some challenges for us. So one of the things is right now we have all the software as grants. We want to transfer that to our partner countries that we're working with. And so we're working with them on setting up pricing models that work for those areas and create more of a standard and set of expectations around that. Also for us, Path is a nonprofit, we're resource constrained. How do we leverage volunteers in appropriate ways that work for them and for us? Integrating the predictive modeling, working with our partners on data governance. Because as we're using data more, we're identifying more issues with data quality, pretty much a guaranteed thing as we're using data more, and how do we work with them to set up processes and plans and so on to handle that. For us for the future, we are already leveraging this tool set for other projects. So HIV, tuberculosis, hypertension, childhood immunization, other malaria projects. So this stack is not disease specific, it's open to other things. Building out integrations with other tools. So for example, we've been working on an app for DHIS2 to embed Tableau into DHIS2 that we'll be releasing at some point. And then we're a public health organization working with assorted public health data. There's many others, and how can we support and share work with them? So that's a quick overview, high level of Visualize No Malaria and how we're using data and what we're doing with it. If you want to learn more, go to visualizenomalaria.org. Feel free to reach out to us. And we're really happy to answer questions. We could talk for hours and go into geeky, nerdy bits of detail on the specific integrations and tools and what works and what doesn't work, or comparisons to other tools and so on. So with that, there's a couple of questions in the queue. If you have more, please use the Q&A or the chat. So the first one was, the user interface shows lots of charts, graphs, maps with multiple filters. How are end users trained to understand and accurately interpret the information they view? And a comment of, I find interpretation is often the most difficult. Yes, I completely agree. So we do have a set of training. Part of the rollout of these dashboards, there's actually videos that they can watch. And we have defined, like, here's a way we can think of a dashboard is really an app. Like we have smartphone apps. So a dashboard is an app that you might be using on your smartphone, might be using on your laptop, that is designed to answer certain questions. So we have training that is materials that say, here are common questions you have, and here's how you use the dashboard to answer those questions. And with that user focus, we also get the feedback on people saying, this dashboard actually took me a really long time to answer this question. So in that case, can we make that dashboard faster and easier to use in that way? Or they have new questions as well. And so either building out views for them, or where we're doing comprehensive training, how can they build those visualizations themselves for users? And with that, we are finding that we do, I forgot to put this in the challenges piece, so thank you for this question, is that we do have to do more with data literacy and analytic literacy and help build that up in users so they understand. And it's the same thing with Excel, for example. People can add a trend line, but interpreting the trend line in a reasonable way takes a higher level of skill than it takes to add the trend line to your visualization. So we are having to do more training on that. So there's a question about the overall purpose of the presentation. So this was to provide an overview of the Visualize No Malaria project and how PATH has used that to impact malaria elimination in Zambia, and more generally, the tool set that we're using that's available to us. And just to say one thing about those tools, you can reach out to Alteryx and Tableau, et cetera, directly to ask about grants and so on. Also, feel free to reach out to us and we'll forward your information directly to those people as well, because we're happy to grow that community of users. So I'll answer one more question and then we'll call it. So there's a question about, given that people's access to Microsoft Excel is nearly ubiquitous, what would you say is the appropriate use of it for data visualization? For example, the utility of static dashboards. So I think so there's a place of, we're using the tools that we have. So I'm really okay with people using Microsoft Excel. I think there's a place of, as people are building visualizations, tools like Tableau, I didn't go into this as part of this, but they enable rapid iteration of exploratory analytical visualization, whereas Excel is more about, okay, I know I need this chart, let me build that chart, which is different from, I have a set of questions, how can this tool help me answer those questions? So that's a place where I see a tool like Tableau complementing Excel, except for the fact that Tableau does a whole lot of what Excel does, and it can actually replace Excel in a lot of ways. Except Tableau does not do write back by and large. So that's, so with the with the write back piece, that's where we use Excel to edit data, for example. So that's a high level answer. If you have more questions on that, feel free to jump in. I see one more question in the queue, but I want to give your day back to you. So, so I will answer that question offline. So thank you all for attending this webinar on data for action and Visualize No Malaria. I hope it was useful to you, and have a great day.